All right. Aloha. Welcome again. I am Dr. Albert Lin, the traveling doctor, and this is my daily COVID-19 update for friends, family, and anyone else. I'm going to introduce myself a little bit because I realized I didn't do that yesterday. I am Stanford graduated for undergrad. I went to NYU Med for my medical degree, and I was trained in internal medicine at Cedars-Sinai, and I've been an internal medicine hospitalist on Hawaii for the last 14 years. So I got that out of the way. Yeah, I guess that's the main part of my, expertise in being able to talk about this. I had a podcast yesterday, but it was a little kind of hard to find. So I'm doing it on my personal page, and I'll post this up on YouTube and on my, other Facebook page later. So I talked about a lot of stuff yesterday. I think I'll go over some of it, but also give an update because a lot of things have changed, as everyone knows, in the last 24 hours. So right now I'm at home, like probably a lot of you. I'm on day number 6 of social distancing and self-quarantining myself. I know it's been difficult for everyone, and it's kind of hard to see the streets empty and a lot of people not doing much, but there are a lot of people who are still doing things. So I kind of want to start and talk a little bit about some of the things that people were wondering about, asked about. I think a lot of this is review for some of you, but I wanted to make sure that you guys get more visualization. So everyone's been hoarding toilet paper and hand sanitizer. We all know we're supposed to social distance. Well, what if you go out and you need to stay clean? Well, first of all, if you come home, the first thing you should be doing is not using up all your precious hand sanitizer, who you beat a grandmother up over to try to get a ton of, but you should be using soap, just soap and water. Again, 20 seconds, soap and water. Sing your favorite song. Like I told my friends, you can sing the chorus to I Want It That Way while you're washing your hands. And you got soap here. Soap, Lever, Dove, whatever you want, soap. That should work fine. That's for most cleaning, when you get back in your house, along with the things I mentioned yesterday, washing your clothes, washing a laundry basket, washing handles, common area, things that people touch. The other thing is obviously hand sanitizer when you're outside. That will be useful to have, especially if you're needing to go out, which again, a lot of you should not be doing. But again, having a little bit, you just need a little bit of hand sanitizer. And ideally, these start to become a little bit easier to get. If everyone didn't hoard them, then some people would be able to get that more easily who really need it. Obviously, there are other things that if you have access to, it'd be nice. If you want to clean your phone, clean remote controls, different things like that, having like some of these small alcohol swabs, clean your phone. Electronics would be kind of useful generally to use. So that's enough about cleaning. Before, I mentioned this last time, but a lot of people were asking some questions yesterday. I don't see anyone on my feed right now, but I'm not sure why that is. So I don't know if that's because I'm doing something different, but maybe you can just ask me questions in the comments later, and I'll go through my spiel. Okay, so the other thing that I talked about yesterday was a little bit about symptomatic medication. A lot of people are trying to figure out if they do get COVID, which a lot of people will get COVID-19, the coronavirus, but again, a more lethal and worrisome kind, as everyone knows right now. You want to get some symptomatic medications, because if you go to the emergency room, which you really shouldn't, like I said yesterday, you shouldn't overwhelm the system. But if you do go there, they'll probably send you home and tell you to take some symptomatic medication. If you're not really sick, you need something to take care of yourself at home, because you're going to feel feverish, dry cough, a little bit of sore throat, some things like that, some muscle aches and stuff. So number one thing, acetaminophen, pain reliever. This is a 500 milligram bottle, okay? You take 2 tablets every 6 hours, or, when you have problems. You don't have to take it if you don't have problems. I would, when I'm sick, I'll take that. I talked yesterday, you can refer back onto why I don't think you should be taking ibuprofen for now. There's some studies that generally show that it's not that, not that it's not well tolerated, but it may not be as effective without some side effects. Anyway, ibuprofen is not great generally in terms of stomach irritation and kidney stuff, if you have kidney problems. Whereas Tylenol, or again, acetaminophen, or the brand name is Tylenol, or in Europe it's called paracetamol, and overseas called paracetamol, that's fairly well tolerated unless you have some liver disease and some other stuff like that. So that's drug number 1, over the counter. And again, please do not hoard this stuff because someone's going to need it and they won't get it. Can you imagine if we just ran out of paracetamol or acetaminophen? I don't think we're going to, but that would be a horrible, horrible day for society and humanity. The number 2 thing, which I don't have on me because I don't have it and it's kind of hard to find, I don't need it right now, is again that guaifenesin DM. It's a big like horse pill shaped kind of thing, and you can either get the immediate release or the extended release. Extended release comes something like 1,200 milligrams / 60 milligrams, take it every 12 hours. It's a massive horse pill. Works really well to control the cough. But that won't really help with the irritation. It will help with controlling the cough so you don't spread it to everyone else around you, your family, whatnot. So that's drug number 2, which I do not have right now. So hopefully you can find it. If you need it, please do not hoard it. A lot of people do need it, just generally sometimes. So number 3 drug, coldies, or what you call zinc gluconate. Zinc gluconate. They're these, usually come in this kind of thing. You take one of these every, about 3 hours or so, 3 to 4 hours. Ideally, you're taking somewhere between 4 to 6 a day. You'll take a package, come with like 3 days worth of it, and you'd finish it, or you don't have to take it completely. Again, it's kind of like with the paracetamol, acetaminophen, you take it as you need it, and this you take as soon as you get symptoms, cough, aches, sore throat, that kind of thing, and it doesn't cure it, but really cuts down the disease. This is a little kind of more homeopathic and off-label. I know some doctors that don't believe in it. I swear by it. I pack one of these in my suitcase all the time. This is also sold out. But again, zinc gluconate is the generic. If you can find that in your Walgreens, wherever, get one. Get one for you and your family. Don't get 100. Don't be that guy. Don't be that guy. Okay, number 4, and this is pretty simple. We have them around a lot everywhere. Halls, okay? Halls, menthol cough drops, okay? This sounds pretty silly, but these cough drops are really good. They almost work fairly well for cough suppression. You kind of have to suck them all the time, and they only last maybe an hour or so, but you can take it every 2 hours or so. They're very well tolerated. Some people don't like it because there's a lot of sugar in it. They have sugar-free versions, which are a little more expensive, but only about $2 a bag, and they're really good. I like them. And in a lot of ways, they help soothe your throat so much that you may not have irritation. You may not cough as much either without any guaifenesin DM. But I do like that guaifenesin DM if you're able to get it. So again, that's symptomatic meds over the counter. I kind of want to talk a little bit about the other hoarding thing, and a lot of people talk about it, but I want to demonstrate it. So the reason why hoarding is a big problem is I'm hearing stories right now, even in the hospitals all around the country. We're running out of, the N95 masks. Have a lot of surgical masks generally, but everyone's running out of N95 masks. The CDC is telling doctors and nurses in the hard-hit zones in the US to wear scarves and bandanas because they don't have enough N95s. People are jimmy rigging them, covering them with saran wrap, trying to buy UV machines for the hospital to sanitize them, saving them. I mean, of course we can ration them, but if you have a lot of these hoarded, I please urge you not to buy anymore and to consider, because hospitals will be asking for you to donate some to the healthcare workers who are going to be taking care of very sick people all the time, very soon. Some are doing it already right now all over the US, and the ones who aren't hit yet, the other states like Hawaii, some of them are going to get hit pretty hard in the next 1 to 2 weeks to a month, and we're going to need some. So if you need some, or if you hear doctors and nurse friends and other people needing some, you need to go ideally do the better things and donate some of them. If you don't know who to donate to in your local hospital, especially the smaller hospitals are going to need them, call the nurse manager on call. They'll take care of it. Or call the attending on call. They will take care of it, and we'll keep a good stash, okay? So again, the one that most people have is this one. This is the surgical mask. And as you see, you put it on, you can fit it to your nose, and this is what you might be able to go out with, although they're not really recommending that. I mean, if you're going out to do takeout, do some things, especially if you have cough at home, it's better for people who are actually sick or having symptoms because it prevents them from coughing and aerosolizing stuff, which again, they're thinking COVID-19 is aerosolized. So you use this, but you don't need to use tons of them. I personally would use it if I'm somewhere, more dense, if I had been traveling, or again, if I'm going to get out, take out last minute, or I have to go out for something, and I know that I'm sick especially, or I'm going to be within close quarters with someone, I would use it. And, ideally I would hope they would use it, but I don't know that you need to use it much elsewhere, unless again, you're symptomatic at home. Then I would potentially use one of these while you're around family and friends who have to be around you. Then the other thing, again, this is the one that everyone wants, and I have one of these just personally, just for me, only one of them. This is the N95 mask. N95 goes on like this. You fit test it to yourself. Okay? I was fit tested for a small one, and then you kind of pinch around the edges, you get a really tight seal. If you can see, and actually you can really breathe the difference, it's a really tight fit, and it's hard to breathe in these things. We don't love wearing them, but if we have to, we need to, especially if we're going to be taking care of COVID patients. These are the things we're running out of all over the country. China is starting to donate some. I think Jack Ma from Alibaba is going to send us like 400,000. We're going to go through those immediately, and China makes more. We're running out of them everywhere. Why else would the CDC be telling practitioners to make scarves and, use other things? I mean, this is ridiculous. We're going to be taking care of patients, and we don't have this. Or we have some of them, but we're not going to have a lot very soon, in a week or two. Then I'm going to get sick. Other people will get sick, and it'll be a disaster. So, again, I got one of them. If you have a lot and you're not using them, and you hear about your local hospital running out, do the better thing. Donate a box or donate a few that haven't been used to your local doctor, again, hospital, again, talk to the nurse supervisor or doctor on call, okay? So that is hoarding. That's stuff people have been hoarding before. And again, other thing that we're running out of, I'm hearing we're running out or, may run out of ventilators. It's not just a ventilator issue. I've heard some good news that like Elon Musk from Tesla and other CEOs are saying that they're going to, CEOs for like auto companies are saying they're going to start making ventilators, which is great. But where do you put those ventilators? We don't have the space for the ventilators, and we definitely don't have all the doctors and nurses that could run those ventilators. Or respiratory therapists. It's not just about making the ventilators. So we do need the ventilators, but we need the healthcare professionals to stay healthy. So you can help by again, not hoarding and not running into the ER every single time if you're slightly better, or not as sick, just slightly sick. So that's it about supplies that are generally being hoarded and that I'm a little bit worried about from a personal level, even in Hawaii. Okay, again, I sort of want to talk a little bit about, because there's been a junk load of new information about potential treatments. To summarize, I talked about some of this yesterday. The big drug was Kaletra was being studied. It was a HIV drug, and that was shown not to be that good. Gilead is studying another drug called remdesivir, and they're still working on the results of that. We don't have all the data for that, but again, that will be hard to get, and it will be more expensive generally. It won't be available everywhere in the world, and definitely not America. The other one that is getting a lot of press today, because Trump also announced that it was basically being put forward. And again, I was talking about this yesterday and predicted it. It's hydroxychloroquine, okay? And that either alone or in conjunction with azithromycin has been shown to have a lot of significant effect on viral shedding viral the presence of virus in a nasopharyngeal swabs, over a couple of days. So they're still trying to work out that data. It's not officially approved, but there's a good chance it will be off-label. Now, this does not mean that you go talk to all your doctor friends and hold up and rob a pharmacy and try to get this, whatever, because again, you're going into hoarding and you do not need it right now, unless you are actually sick with COVID, and especially more moderately and critically ill. In other words, you'd be in the hospital, and the hospital can give it to them, unless we don't have any. And I'm hearing rumblings that around the country, we're starting to run out of that already. We only are running out of this because everyone's making a run on it. So everyone's got to think humanely. The hospitals have to think humanely. How much do we really need right now? Can we help each other out? But you cannot make a run on these drugs. And ideally, it's not like toilet paper and hand sanitizer. You can't get this stuff over the counter. You need a prescription for it. I'm just educating you on it, because if you have friends who are bragging they're getting it, or it's being sold on the black market, which I wouldn't trust right now anyway, it's not a good thing, because you're keeping it away from someone who it literally may be life or death for. And a doctor may not be able to order it for their patient because you have it sitting in your freaking medical cabinet, which you don't need right now because you think you're going to be sick. That is not, Gennady just wrote, I'm glad he wrote because I wasn't sure that it was working. People do need this for other conditions. It's a general inflammatory medication. People with rheumatoid arthritis and lupus. In other words, people who are already immune compromised need it, and they won't have it. So not only will they not be able to treat their condition, they're the most likely people who will get sick, who especially are younger, which I'll get into later. So please don't be a horrible person. Don't be that guy, be the person that would get up from a subway, seat and give it to a, pregnant or elderly person or whatever. Don't be the person that hoards from someone who really needs it. The reason why we need markets to have special hours for, elderly people to not get sick and not get run over just so someone gets one roll of toilet paper or one hand sanitizer bottle. So, I went into enough about some of the potential treatments. I've heard one that I just want to sort of put out there. It's another antiretroviral. It's getting a lot of press in Asia. Fujifilm, Japanese company. It's another one called favipiravir. I don't even know how to say it. Favipiravir. I guess that's how you say it. And again, based just on how it's spelled, again, it's an antiretroviral. It may be, acting similarly to Kaletra. Oh, and by the way, hydroxychloroquine works a little different. From what I understand, it's not an antiretroviral. Again, it used to be an anti-malarial drug, and they think it works by preventing the virus from binding to epithelial linings, like in the lung especially, whatever. And because the virus cannot bind to the epithelium, it can attack it and cause inflammation and all this bad pneumonia that you hear about. And that's how it works. But this works very different from these antiretrovirals. Again, these antiretrovirals, I love if they worked. I'm sure the pharmaceutical companies have a lot of money invested in it, and they're much more expensive, and they would love people to buy those. But hydroxychloroquine is the smaller one, okay? So no, and Stefan from, I don't even know where Stefan is right now. He's asked me to say that 10 times fast. I cannot say it 10 times fast. I can barely say it once. Favipiravir. That's 3 times for you, Stefan. So I guess I'll answer a couple questions coming up, but let me finish by looking at a little bit of a update, both prediction-wise, which I mentioned a little bit before, Hawaii nationally and internationally, because I don't know how far away people will be watching us from. I have a lot of friends who live in Europe and Asia and overseas. Oh, thank you, V. That's you're too kind. She mentioned that I am somewhat handsome, but I don't think I even combed my hair today. So my prediction, again, yesterday I said we're on the chart at this point, about 9 days behind Italy. And Italy's got some bad news, as I mentioned yesterday. I really think, and you've seen the numbers, we've shot past, I think we're past 10,000 already. I wouldn't be surprised if we're at 30,000 by next weekend. 30,000 cases That doesn't mean active cases, but 30,000 confirmed cases in the US. And again, as we ramp up testing, everyone's like, oh no, why can't we get tested? And then when they get tested, they're like, oh no, why are there so many cases? It's because you tested all those asymptomatic people, the younger people, Gen Z, millennials, who, were not feeling that bad, maybe a little scratchy throat or, some cough, and those numbers would go sky high. So, what I think they've mentioned too, and I 100% believe this, we will cure this, but it won't peak and then go down and stay down forever. Like, I 100% anticipate this, a secondary bump. So it'll go like this and then slowly come down. And then in October, we'll start seeing it again. And then that's that secondary bump to December. But this time we'll be way better prepared, maybe have a vaccine, just have stuff. And then we may get these little bumps, kind of like separate months all the way through this time next year. We may have 2 or 3 bumps. So we got to be prepared for this. I mean, I don't think this will change life forever as we know it once we get past this part. And I'll tell you why I think that's actually a positive thing later. So again, I won't go over all that flattening the curve and stuff. I have a really interesting graphic I want to put up that I actually saw on CNBC, and it shows really importantly, different from the curve you're used to seeing graphically about slowing active cases, what we can do if we get ahead of Italy, which again, the goal is be South Korea or Singapore or Taiwan. Do not be Italy or China. China, ignored stuff. I don't even want to go into all that in the politics and whatnot, but Italy was just not prepared and didn't, take it seriously enough. And so we are learning from Italy's pain right now. Even people like me who thought it was a little less big of a deal than, I gave it credit for. And if we're going to do this, let's do this, full, steam ahead, 100%. Let's not, sugarcoat it or, beat around the bush with it. So that's my prediction nationally. So what does that mean? Okay, the Hawaii update is this. We are up to 26 cases. You may not have heard, or it's probably all over your feed. Even our famous people, Daniel Day Kim, who was Jin from Lost, and Chin Ho Kelly from Hawaii. He has it. He flew back from New York. Ironically, he was playing a doctor who was brought in to a hospital to fight a flu epidemic on New Amsterdam, and he got, it's not funny, but it's ironic, he got the coronavirus and he flew back on a plane to Hawaii. So now they got to track everyone on that plane. I'm sure he didn't mean it. And we all, hope he gets better. It sounds like he's doing really well, like Tom Hanks, and he's a strong, younger guy. I'm sure he'll do well. We have a state senator who's sick too. So that's the 26 cases. Asked, does China really have no new cases? It's China. Take that as you will. Believe their numbers or don't. Do they really not have any new cases? They don't have any new cases they're either releasing or that they've tested for. They've sent home some medics. They've closed all their temporary hospitals that everyone was amazed they could build in 2 weeks. So do they really have no cases? Listen, they're a country of more than 1 billion people. I think they have one new case they just haven't caught. But they don't have a lot. They don't have, maybe deaths or so. And they definitely have gotten way past flattening the curve, and they're past their first big peak and bump. And they do not want people coming in. So I'll get to that with the international thing about how many restrictions there are. So anyway, with Hawaii, again, one of the things people have been asking about is, tourists, what the heck is going on? Yesterday, I think we closed, or in the last 2 days, all restaurants, all bars are closed. You can get takeout, but all restaurants, all bars are closed. They closed all state parks. Technically, some of the beach parks, like Diamond Head, certain beach parks, Waimanalo Beach Park, the beaches are closed. But people, if you saw some of my pictures yesterday, were crowding Waikiki. So it's hard because as long as the planes still come through, as long as cruises come through, we have no control over that. That's just tourism. And again, tourism is the lifeblood of Hawaii. Lieutenant Josh Green, Lieutenant Governor Josh Green, we've been talking with him, we as in a lot of the doctors in Hawaii, and because he's an emergency room doctor, he's taking a lot of this to heart. And I think, and I hope he's been able to talk to Governor David Ige, who unfortunately, I think he's been really slow and behind the ball on this, and he's bouncing a lot of stuff. I think he needs to act further. In fact, if you want to bug him about this, go tweet him at GovHawaii, at GovHawaii on Twitter, okay? I will do it right after this and link to this, podcast and other things. I think we need to lock stuff down. I think we need to do what they've been doing in other places, like, Australia or Italy. For example, if you go out, you can't just suggest to people to self-quarantine once they come here. I think there's got to be a way to enforce that, fines or something. They fined something like 35,000 people in Italy. I think I mentioned this yesterday for being out and breaking the curfew. The problem is we cannot ban all flights and all boats into the state easily, especially flights. I mean, maybe boats is different, but definitely not flights. I mean, that's a federal mandate. I mean, once they buy a ticket on a flight to come to Hawaii from California, Washington, whatever, they're on the plane. There's no customs, there's no immigration. They just walk in. We can try to temperature screen them. We can do something really severe like Hong Kong, where they put a bracelet on you. Hong Kong puts a bracelet on you, and they electronically track you. They track you to make sure you don't leave your hotel wherever you're at. They get all your information. And for different human rights reasons, and we're American, and whatever, it's probably not going to happen here. So the only thing I can say is maybe Hawaii needs to say no foreigners, kind of like Australia, Hong Kong, New Zealand. They're saying no foreigners. Canada said no foreigners. I mean, people have been giving Trump a lot of crap about that with China, and I won't give him crap for that. That was the smartest thing he did, actually. He's done many not so smart things, but he bought us probably 1 or 2 weeks time, and that's probably why we're behind Italy. If not, at least partly we're behind, Italy, meaning that we have time. That's important. We need to stop. It's my medical opinion, we need to stop all foreign tourists from coming into Hawaii and just send them back. Or if they want to come in, then they're in forced quarantine for 14 days. Now, you can't really do that for Americans, but you can do self-quarantine for 14 days and fines outside. I mean, I think that's good. Quarantine people for self-quarantine for 14 days and figure a way to find them. I don't know. Have them carry around their plane tickets so they can show where they are in case they get stopped by the cops. I mean, I know this sounds like Big Brother, whatever stuff, but I think it's really important. We're a very small island and we have a ton of international exposure. I do not want us to be like Italy, and we're in danger of something like that, even though we're not as big a city as New York and all these other places. So I don't want to freak too many people out, but that's basically the major issue I think we need to do personally. And by the way, the U.S. has officially said we are level 4. Now, what does that mean for the country in terms of travel? Level 4 means no non-essential travel. I mean, some people will still need to travel for now, but I would question going to travel. I know a lot of people in Hawaii, and I know a lot of people in all over the U.S., especially for Hawaii, saying, "Oh my God, look how cheap tickets are. Let's go." So Hawaii, is dealing with this problem because everyone wants to ride out the apocalypse in paradise and surf with a Mai Tai, if they're going to get sick or not get sick. They may be sick on that plane already, and that's the problem. So, I just don't travel. I think we need to enforce a 14-day quarantine, definitely forced for foreign people, and then somehow, ticketed and fined for, people who come back who are local. I mean, I don't know how we do that, but we have to figure out a way to do that. And I'm not talking about forever. I'm talking about for like 14 days, guys, 14 days to, 3 weeks or more, it could be longer, but you start with 14 days and that'll make a huge difference in flattening the curve. Okay, so I talked enough about Hawaii. Sorry, I know I scratched my face. Should not have done it, but I did again wash my hands before. So you know how easy it is. You're just itchy and you scratch your face. They found, by the way, COVID, it lies on your hair. It lies on your eyelashes, your eyebrows. So you can get really sick from that. And let me talk about a little bit of world updates. So a little bit of more depressing news. Italy has now surpassed China. What I mean by that, there are more deaths in Italy now, and they're not anywhere near done compared to the entire country of China in terms of total deaths. Now, how many of those total deaths in China do I really believe? Do I really believe the number is that low of whatever 3,900, wherever it is, or do they have more? They probably had more, but again, officially, Italy has, surpassed China. That's pretty horrible news. And again, those are deaths that have come fast and quick, all at once. So that's not very good. Now, I've heard some other things. They're doing cremations in bulk in Italy. Now, I have to verify this, but I've heard that that's a big thing. And if you know Italians, that is not a thing they do a whole ton. They're not like Hong Kong that is fine with doing forced cremation. China did forced cremation. They didn't allow people to say goodbye to their family, touch them, hug them, have funerals, have wakes. They burned the bodies. And Italy apparently is doing that. And as far as I understand, a more Catholic society, you're more about burials and funerals. But they are doing what China is doing right now, forced cremations. That's what I'm hearing. So again, I want to check on this. Don't take that as a word, but that is what I'm hearing right now. And I mean, that I don't want us to have to be in that point. So other world updates. I mentioned this yesterday. France and Italy are showing signs of younger people being sick. And I heard a very interesting theory why. By younger, I mean the 20 to 40-year-olds, and everyone was like, I'm going to live forever. Let's go and party and drink. I don't need to take care of anyone. Who cares about the boomers? Like boomer, bye-bye hashtag, or, hashtag call the herd. I've literally heard that's a hashtag going around. Hashtag call the herd and like hashtag boomer good riddance or something. And it is horrible. Isn't it like really where we're at as society? That is not going to endear you to older people, And, karma sucks, but that may happen to someone you actually do care about who is slightly older than the age of 50 and has chronic, disease and problems. Anyway, what I'm hearing is that in France and Italy, again, 20 to 40-year-olds are getting sick. And even in the US, there are 20 to 40-year-olds that are getting sick. A 37-year-old guy who's an Armenian, who I think my friends know, in Pasadena died. A 37-year-old guy who I do not think had major health problems. Again, I don't know for sure. He died in Pasadena after being sent home. He had 2 kids, 37-year-old. Imagine yourself in those shoes. That's horrible. So things are not, the death rate is lower. It's 0.1 or 0.2 or 0.4 to people up to like 40 years old or something. But it goes up a lot after that. And one of the interesting theories is, and I don't want to say that as for real, is that we're doing such a good job of protecting older people that there are not a lot of older people outside. And in fact, only the sicker people are the less careful or less lucky, younger people who are going around and running around. They are getting a lot sicker. And in fact, maybe we don't have a lot of older people in the hospitals right now, or not as much proportionally and percentage-wise, because we are possibly starting to flatten the curve already, at least for the older people. We don't know. The data's too early. I think it's too early to call that. I think we still need to do everything, and we still need to protect anybody. Treat this, I heard a great quote, from someone. Treat this like it's not killing older people. Treat this like it's killing your kids at a 15% rate, like it's killing babies. I think there was a hedge fund guy who was like freaking out on TV yesterday. Some people know him, Ackman. And he was freaking out, but he has a good point. If we treated this disease like 15% of babies could die if we didn't do this stuff, I think people would take it more seriously. I mean, there's this unfortunate thing that, older people will die. And I'll admit, I'm at risk of thinking that sometimes. So we got to treat it like that. And we got to do that. Okay. So I think I sort of want to leave it there. I want to say some last inspirational stuff because, again, this has been probably depressing for everyone who's watched this for the last half hour. And then I'll answer any and all questions. So please type any of the questions down there. I'm seeing a few more there. But if you have any last questions you want to ask me in the last, I'll probably keep this for another 10 minutes going on, then I'm happy to answer any and all questions. But inspiration-wise, this is what I think. I don't think this is how we die. I don't think this is how we go out. I do not think that humanity, suffers beyond a lot of the immediate stuff right now. I mean, obviously financial, unemployment, all these things, that will take a while to come back. People don't have checks. People, are seeing loved ones die. I mean, of course, but that's bad. But I think we still have it under control, especially in America. We have a way to take care of this, and it's not that hard. So I think we really need to take inspiration from that. I will say one other thing that I think is kind of a little inspirational is that if we do these things right now, not only do we take care of coronavirus and COVID-19, but think about it logically, next season. Now, again, I don't want to say this is like the flu, but like last year, does anyone know offhand how many people died of the flu on average from 2010 to 2018? I had to look up these statistics. And they varied per year. but a lot of people know thousands, this, that, whatever. But over the entire flu season, there's an average of anywhere from 12,000 to I think it was 60,000 or so people died of the flu. Now, my point is this, not to treat coronavirus like, oh, it's the flu, and it is worse, in terms of we don't have a vaccine, all these things that I won't go into. But the point is, if we still do these things next season, at the next bump on the winter, those numbers for the flu logically will decrease. Instead of seeing 12,000 to 60,000 people dying of the flu and no one freaks out about it, why aren't we freaking out about it? Why didn't we freak out about it before? Why didn't we help save some of those people? And I think, inspirationally enough, if we do these things, we will save those people next year. There will be less flu deaths. This is my theory. We'll see next year, but I anticipate that we'll see lower flu mortalities next year because everyone will be so fresh in their memory, freaked out from coronavirus. They will do all the things as we start to see more corona or COVID-20 bump up or whatever they call it. And the flu come in, people will start to do these self-isolating, social distancing things again, and I think that's a good thing. I really do. So yeah, as V has mentioned, we need to, hashtag stay the F at home. And it's not that hard. I mean, it's painful. I'm on day number 6 right now. I'm on day number 6. I have not gone out except to drop off the garbage, pick up some quick groceries or a takeout, covering myself and hand washing everything. I have not gone out. 6 days. I've got, I think Friday, Saturday, Sunday, Monday. I got 4 more days of this and I go back to work. I go back to work with people who by that time will probably have it. Now I've heard it's not too bad in Hawaii yet, but we may get there, So, but anyway, my point is just to stay at home, wash your hands, be smart. Please don't hoard. Consider donating. You don't have to do it right now. I think we have enough right now, but consider donating some of your N95 masks. Some of them. I'm not asking you to do all of it, but think about me like not having that one mask when I need to intubate somebody or take care of someone sick. And you don't want me to be sick, hopefully, or the other brave nurses and respiratory therapists and the people who are, helping them out. Because we're sick, we're gonna run out of people to take care of people, and that's gonna get pretty hairy. I'll go into in next podcast about why I think we're gonna need some help with not just healing people, but where do we put them afterwards? Maybe I'll focus tomorrow on that. Like, where do we put them? Because once they're healthy, do you just put them right back in the community? Do you put them right back with their family? Do you put them somewhere else? How do you keep them from getting reinfected? How do you keep them from infecting people who weren't infected? This is very complicated. We're sort of learning, and we are learning from China and Italy in both good and bad ways, So that's about it. If anyone has any other questions, you can add on to this. Again, I am trying to figure out how to download these Facebook Live videos and put them on my page. Again, you can like my page at facebook.com/thetravelingdr. And then Instagram is at thetraveling_MD. I'm on Twitter at thetravelingdr. And I'm setting up a YouTube channel. I just search for The Traveling Doctor. I don't have much posted up, but I will try to post this up and my future podcasts and small little other things onto YouTube. But I figured I'd start with Facebook first since I don't honestly know everyone's YouTube. So that's it. If there's no more questions, I think I'm going to end it. So again, I'm fairly hopeful still. We are increasing in the cases in Hawaii and both nationally, but just do what we're supposed to do, and I think we'll all get through this, honestly. I can give my predictions on when I think this will end, but again, I think that's for another day right now. So that's about it. And again, this is the March 19th COVID-19 daily update podcast by The Traveling Doctor. Aloha, Grace from Maryland. I'm sorry, I do gotta go. But please, again, I will make this link public. Feel free to share it to anybody. I don't make a lot of stuff on my personal page public, but I will make this public. And again, I will try to put it on YouTube in case you have those people who are not on Facebook and have quit. I will try to figure out how to download this and put it on Facebook, okay? So that's it. Aloha, and I will see you tomorrow, okay?